Good evening. Good evening, everyone, and welcome to our forum on PCOS, polycystic ovary syndrome. This evening, we really hope to get some information out there for all the women who may be suffering with PCOS and who would really like to know how to manage their symptoms. A lot of times when we speak about PCOS, we just speak about how horrible it is, but we don't really get to speak about how do we manage these sometimes horrible symptoms. So this month, September, is PCOS Awareness Month, and we, the Dominica PCOS Association, in partnership with the Dominica Planned Parenthood Association, decided to put on this educational session so that people can really get to know a bit more about managing PCOS. So it's all about managing PCOS this evening, being empowered that you have a condition that is devastating to you or that is troublesome for you, but to get that empowerment that you can actually manage this condition and you can thrive even if you are a sister. So this evening we are sponsored by, as I said, this is in collaboration with the Dominica Planned Parenthood Association, which is our major sponsor, but Jolly's Pharmacy is also one of our partners in this endeavor, as well as Lovely Things and Meraki Designs. And so we have some display of their products this evening. We also have with us a very nice display of the herbal aspect of treatment, and we have our herbal physician, Renal Deja Parker, in the house this evening, so we will be focusing on the display. And we also, of course, have our presenters, our doctors who are here, our pharmacist who is here this evening to present. So we are gearing up for a very informative session. So for the viewers on Emo Live, if you are viewing the live and you know a lady, you know a woman who would really benefit from the information that we are about to share, please share the live. It's a rainy evening, so some people may not be able to come out, but we are here at UE Open Campus, and if somebody can get the information via a virtual means, so be it. Please share the live, as Issa Banton would say. Yes. So we want to, before we get into the presentations, I wanted for some of us PCOS sisters, we call ourselves sisters, Cysters. I wanted us to share what is the most troubling symptom of PCOS for you. What symptom do you find the hardest to manage? So I just want to call up some of the ladies that we have here of the PCOS Association to share what is the most troublesome, the most difficult symptom. I talk about my PCOS struggle all the time, so now it's your turn. Now it's your turn to just tell us what is the most troubling symptom for you. Who's coming? Amanda, you know I'm calling you first. So what is the most troubling symptom to manage for you? Come to the mic, come next to me.
Hi, good evening, everyone. I'm Amanda. The most troublesome aspect that I face with my PCOS battles is excessive facial hair. If I don't, and this is a thing that all our sisters can attest to, if I don't shave or if I don't wax or if I don't pluck my facial hair every day or every 2 days, I would end up with a full beard and mustache. So that is the one that is most troubling, because that is the one that most people see. Of all the symptoms that we can have, that is the one that they see most often. And especially in my profession as a teacher, you can imagine when students tell you, but miss, as if you have a beard, what's going on? That you have to take some time out of your class and kind of explain to them why you have what you have. So I think that is one of the most troublesome ones. And the other one is sometimes the fatigue that goes with our symptoms. Sometimes we get really, really tired, and some people just don't understand why we're so tired. But it all has to do with what we're facing as sisters. So those are some of the most difficult symptoms that I deal with for me. Yes.
Thank you. I know some of the viewers on Emonews are asking, what is PCOS? So when we get into the presentations in like 2 minutes, that is going to be very well explained. So don't worry. You just need to stay logged on to this session and you will be educated. I need another sister that wants to share her most troubling symptom. Anel, I'm looking at you. I'm looking at you.
So good evening, everybody. I am Anel. One of the most troubling symptoms for me is weight gain. You always get, Lisa, I was looking at you. You always get, are you pregnant? That's one of the most common questions. Sometimes if somebody doesn't see you for long, they say, but you gain weight, man. But how you get big so, So weight gain is one of the most troubling symptoms for me.
I think we can testify to that. I said I wasn't sharing my most troublesome symptom, but that's definitely mine. And last year I was doing so well, and this year I'm not doing well. And as a sister, we know that, sometimes the struggle can take turns and twists, but the weight control issue is a definite struggle for me as well. Anybody else? I see Lisa smiling. Okay, if the others are shy, we're going to go straight into our presentations this evening. So I will. Oh, you want to share another one? Okay. In the spirit of sharing, Amanda wants to share one more.
In the spirit of sharing, I'll share one more.
Okay.
One other issue that we have is the insulin resistance. For most of my life, I never had any issues with diabetes, and I was diagnosed with diabetes to the point where I'm now off metformin and in insulin. That's how bad it can get. So that's another thing that a lot of us deal with when it comes to polycystic ovarian syndrome, is the insulin resistance, which sometimes leads us to becoming diabetic.
Most definitely, and that's why the awareness is so important, so that some of those negative outcomes can possibly be prevented or protected against as much as possible. So we're going to go into the presentations so that all the questions that people may have about what is PCOS can get answered. And as I said, we're going to talk a little bit about the symptoms and how they can be managed as well throughout this session. So I'm going to introduce our first presenter this evening, who is Dr. Natasha Maxime Esprit. And Dr. Esprit hails from the beautiful southern village of Belleville-Chopin. Any Belleville-Chopin people? Good evening to you. She majored in biology and Spanish at the Dominica State College, and subsequently from 2009 to 2016, she did general medicine at the Romulo Gallegos University in Venezuela. Between 2018 and 2021, she specialized in endocrinology under the University of Medical Sciences at the largest endocrine institute in the Caribbean, the National Institute of Endocrinology in Havana, Cuba. Dr. Esprit is currently employed as a specialist medical officer and endocrinologist with the Ministry of Health in Dominica. Her role in that position is to oversee prevention, diagnosis, and treatment of diseases related to the endocrine system, including but not limited to pituitary tumors, thyroid and parathyroid disorders, adrenaline dysfunction, diabetes mellitus, obesity, polycystic ovary syndrome, and other hormonal disorders. So I welcome Dr. Natasha Maxime Esprit to the podium this evening to present to us, first on board for this PCOS forum.
Pleasant good evening to everyone. It's a pleasure to be here today as we culminate PCOS month, the month of September. I hope that during this month, those of you who are sisters were encouraged that you are not alone in the struggles that you face, like some of you all mentioned today, and that there are treatments out there that could assist in your management. We have the professionals here in Dominica to assist with the treatment that you require. So it's a pleasure to be here this evening. I'm here to share knowledge and also to receive, as I myself suffer from PCOS. So it's just a pleasure to be here. Today I'm going to share with you the hormonal disorders and their clinical expression. So we're just going to look at the main hormonal disorders which are associated with PCOS and how they're expressed clinically, meaning physically how they're expressed. And I just want you to have a little bit of an understanding of what is going on with your body if you suffer from PCOS. To those of you who maybe listen live or are here present and you do not suffer from PCOS, the aim of this event is to build awareness so that you could be able to identify signs and symptoms, maybe not within yourself, but maybe in your daughter, in your cousin, in a co-worker, so that we could do some early diagnosis, prevention, and treatment to prevent the complications of PCOS. So just listen carefully as we share some information with you. So just to give a little history, as you can see here, we have this lovely man, Antonio, in 1721. Even back then, we had descriptions of women, mainly after autopsies were done, who had the characteristics of PCOS. So for example, here he described a young peasant woman married, moderately lump, I guess you can imagine what that means, and infertile with ovaries larger than normal, like dove's eggs, lumpy, shiny, and whitish. That description was done in 1721, and he was actually speaking of a woman with PCOS, but just imagine back then we did not have the technology nor the biochemical availability that we have now to make diagnosis. In 1945, Fall were regarded to have been the first investigators of polycystic ovary syndrome. In 1990, the diagnosis was included in the list of diagnoses for the National Institute of Health, and then 3 criteria for diagnosis were confirmed. One being what we refer to as hyperandrogenemia, which I'm going to explain to you what that is later on. Chronic anovulation, which is related to, as in an expression, an irregular menstrual cycle, which we will talk about later on. And the famous one that everybody looks for, cysts on your ovaries, what we refer to as cysts on your ovaries. So these were the 3 clinical and biochemical expressions that were listed for the criteria of the diagnosis of PCOS. In adult women, we require 2 out of 3 to confirm diagnosis, and in the field of endocrinology for adolescents, we require that they present to confirm diagnosis. We require that they present all 3 of the criteria. So we're going to begin to look at the hormonal disorders, the main ones, because there are many hormonal disorders. Begin with the pituitary gland. The pituitary gland is a small gland we have in our brain, at the base of our brain, and it's known as the mother gland of the endocrine system. We have 9 hormones presented there, which are produced there, and they control everything which happens with the endocrine system in our body. So we are just going to pinpoint a few, about 3 or 4 of the most common hormonal disorders which happen in PCOS. Before we go directly into the hormone review, a little bit of underlining, a little bit of education as to the hormones. The hormone has many functions. However, I just highlight which are directly related to PCOS at the moment. So for example, sometimes you go to your gynecologist or you go to the endocrinologist and you see they give you a list of hormones to do. And you wonder, but why? What really are they looking for with that long list of hormones? So, for example, estrogen. Estrogen within our ovaries helps stimulate the growth of our follicles, right? Another hormone that may indicate is your progesterone. When an egg is released by the ovary, progesterone encourages the thickening of the uterine lining, ready for a fertilized egg for implantation, right? It's a very important hormone, especially during pregnancy. The androgens, what we refer to as male hormone, right? And mood. As I mentioned those things, you might be able, especially those of us who are sisters, you might be able to see where those hormones start playing in their role in PCOS. Insulin is responsible for the regulation of our blood glucose, our blood sugar levels. One of the hormones that you may see that your doctor indicates LH and FSH. LH is the luteinizing hormone. It stimulates the release of the egg, that process we refer to as ovulation. It also is the mother hormone. Remember I spoke to you about the pituitary gland. So it's the mother hormone that controls at the level of our ovaries the production of testosterone and estradiol, which is a type of estrogen. And then we have the follicle stimulating hormone, which stimulates the development of the ovarian follicles. So these are some of the hormones. When you go to your doctor, they may send you to have it evaluated if you're trying to confirm the diagnosis of PCOS and determine what hormonal imbalance you're suffering from. Now, as one of our sisters spoke about, insulin resistance. This is one of the main hormonal imbalances that we see in PCOS, and it's of great importance because we are seeing a rise in the incidence of prediabetes and type 2 diabetes within women of reproductive age. I can attest to that. Almost, let's say every 2 weeks, I would diagnose at least 1 to 2 women between the age of 20 and 40 with type 2 diabetes. Right? And I'm referring to here in Dominica. So insulin resistance. What is insulin resistance? As one of the sisters brought it up as one of the things that she suffers with. Insulin resistance, basically, as you can see, I have 3 organs here. The pancreas is the organ responsible for producing insulin. And like we said, insulin is the hormone that is responsible for regulating our blood sugar. Insulin is supposed to move from our pancreas, go to our bloodstream, then go via our bloodstream to our tissues to metabolize glucose, right? But what happens with insulin resistance is that there is a block at the level of the tissues. The tissues are saying, we are not going to welcome insulin. So insulin is saying, if you don't allow me to enter, I'll just go back to where I came from. So insulin accumulates in the bloodstream, right? With insulin accumulation in the bloodstream, the tissues are not receiving the insulin that they're supposed to receive. And insulin is responsible for transporting glucose, for transporting blood sugar. So wherever insulin accumulates, blood sugar will eventually accumulate there. So that's what happens in resistance. So to not receive insulin properly, we have an accumulation of insulin in the bloodstream, and eventually you begin to see as time passes on, if insulin resistance is not diagnosed, if it's not treated, you begin to see your blood sugar levels rise. So it never begins. Some of you might say, but I go to the health center or once in a while I check my blood sugar and it's normal. So why is the doctor telling me that I have insulin issues? Because it never really begins with elevated blood sugar levels. It begins with elevated insulin levels, and when we measure the ratio between your blood sugar and your insulin levels, it's off balance. Your body is producing too much insulin to try to control the bit of glucose that you have in your bloodstream. So we screen you with a fasting blood glucose and a fasting insulin to see if you're insulin resistant, right? If insulin resistance is not corrected, then you move on to become pre-diabetic. And if that prediabetes is not controlled and reversed, then you move on to become a full-blown type 2 diabetic, okay? Here is just a depiction of what I just described, where you have the normal process, where you have a balance between glucose and insulin. And if you look at the others on the other photo, you would see we have too many insulin particles in correspondence with the glucose that we have. This right here are the 2 main common expressions of insulin resistance. In the first photo, we see the hyperpigmentation of the skin, which is generally around the neck, under the arms, between and under the breast, between the thighs, right? A lot of times it's mistaken for other things, but it is the clinical term for it is acanthosis nigricans, right? And it's very common, especially in people who, not only women, but in people who are overweight. That's one of the expressions of insulin resistance, and it's something that not only for PCOS, but people who suffer from being overweight, even in children. I'm having a lot of children right now, 7-year-old, 8-year-old, 9-year-olds, with insulin resistance. Some of them are already pre-diabetic. And one of the things that we screen for, especially at the community levels, is the acanthosis nigricans. And next to that photo, we see an increase in fats, right? And that type of fat, especially in PCOS, has a very different distribution, right? Usually it is accumulated around the abdominal region, the stomach fat. And when you do your ultrasound, sometimes the doctor might tell you you have fat around your liver. So usually you have an accumulation of abdominal fat and what we refer to as visceral fat around the organs on the inside, which is very dangerous, as you would imagine. Here we have insulin resistance, and we can see some of the complications, which are sometimes also clinical expressions of PCOS. So for example, in consultation, I would have a 23, 24-year-old recently diagnosed with hypertension, and she's trying to wonder, but why am I hypertensive at 2 years old? Why am I diabetic at 23 years old? Only to find out that she had underlying PCOS that was not diagnosed and not treated. So we have here, for example, inflammation, high blood pressure, sugar cravings, especially at night, dyslipidemia, which is basically a term for high blood lipids, so your high cholesterol and fat levels, drops in your blood sugar, heart disease, depression, stroke, obesity, diabetes, kidney stones, and among the most serious and more threatening, cancer. So all of this can result from insulin resistance. And like I said, we're not only trying to catch insulin resistance in PCOS patients, but just generally, even from the children, if you see they have excess weight gain, they have the hyperpigmentation and so forth, you should take them to the doctor to get screened for insulin resistance. Another one of the common hormonal disorders in PCOS, like one of the sisters mentioned, and it forms part of the criteria for the diagnosis, hyperandrogenism. That's a big word for the common way of saying elevated male hormones, right? That's how usually when we're talking, that's what we refer to it, elevated androgens. What are the clinical signs of elevated androgens? And that's where your doctor might send you to do a testosterone, right? And also, there is another androgen which is produced by the adrenal gland. The adrenal gland are two little glands we have above our kidney. And there's another hormone which is the DHEA, which we send to screen also if you look at hyperandrogenism. So the clinical signs of hyperandrogenism, the most common one, and the one that gives a lot of us trouble, hirsutism, which is the excess hair growth, the male pattern hair growth, right? And it is, as like I said, it's the most common expression. Other clinical ones, we have acne, especially the facial acne. Sometimes you can have it on your back and on the chest, the oily skin, and also the falling of the hair in what we refer to as an androgenic pattern. Usually it starts from the middle of the scalp. Okay, all these are expressions of hyperandrogenism. Here, these are two photos I took to share with you that was from consultation last week. These are two women, one is 23 years old and the other one is 32 years old, and we can see here the facial hirsutism, different patterns. In the second photo, you can see that she is already beginning to have folliculitis, which is very common when you have the ingrown hairs, especially if you're doing shaving with the shaving sticks. That can be an issue. And you can also see there the mild acanthosis that she presents. One of them was diagnosed with PCOS and prediabetes. The second one is a type 2 diabetic and also suffers from arterial hypertension, high blood pressure. Also, when we speak of hyperandrogenism, we can take it a step further and speak of something that is a little bit more complicated, a little bit more extreme, which is virilization, right? And what is virilization? When the female body develops physical characteristics that are similar to the male body, it is called virilization. To give you a perfect picture of what virilization is, think of when you see, well, we don't have a lot of that here in Dominica, but when you see on the TV, when the women are doing their transition into becoming men, and they're receiving hormonal therapy and so forth, you actually begin to see the changes in them. You see the hair growth, you hear their voice start to deepen. So that is basically what virilization is. And that can happen in a PCOS when you have high levels of androgens in your body, male hormones. So we see things like the voice changes, you have a lot of muscle mass, you have a male pattern baldness, acne, an enlarged clitoris, mood changes, a low sex drive, polylibido, and irregular periods. So according to the levels of androgens that you have in your body, you could have just mild hyperandrogenism, but there are cases where women actually present virilization. Another one of the hormonal imbalances that is common is estrogen dominance, hyperestrogenism. That is basically high level of estrogen in the body, and it can occur frequently. It's one of the main issues and one of the main factors when we look at the irregular menstrual cycles. It can also be associated with unwanted hair growth and acne, and that is one of the main issues where we have the multiple fluid-filled cyst-like sacs on the ovaries, which are really, as Dr. will explain later to us, are really follicles that we have there that we refer to as cysts on our ovaries when we do the ultrasounds. And the lack of ovulation results in continuous high levels of estrogen and insufficient progesterone. So that is one of the questions a lot of times I get from the clients, especially when they have been to the gynecologist and they come to the endocrinologist. They said, but why was I placed on progesterone? And that is one of the issues that we have. We have high levels of estrogen and then we have insufficient progesterone. And remember, we spoke about the role of progesterone in the woman at the beginning when we were looking at the hormones which play an important role in PCOS. Constant estrogen exposure may cause the endometrium, so that's one of the things we look at, to become excessively thickened, which can lead to heavy and/or irregular bleeding or anovulatory uterine bleeding. So a lot of times you can have cases where that's seen a lot in gynecology, where you are bleeding and you're having a regular period, but you're not actually ovulating. Right? And that's one of the expressions of hyperestrogenism. So here we have a diagram where we see polycystic ovary syndrome. We have here an example of what a normal ovary and the process within a normal ovary looks like. So you have your primordial follicle, and it's supposed to develop into a primary follicle and a secondary follicle, a mature follicle. Ovulation is supposed to happen. And all of that nice process is supposed to happen in a healthy, functioning ovary. However, when we look at the polycystic ovary, we see where development stops. Because of all those hormonal imbalances happening, we do not have the development of the follicle into a mature follicle. And all we have is multiple immature follicles, which is what is expressed as the cyst. That's what we have when we look at the ultrasounds, multiple immature follicles, and that is basically the root of the disorders in the menstrual cycle, the infertility, and all of the. Right. Now, when you professionals speak of PCOS, you may hear that they say it's a diagnosis of exclusion. And in medicine, when we talk about a diagnosis of exclusion, what we're basically trying to say is that other entities, other diseases have to be ruled out so that we can basically say, okay, you have PCOS. And there are some other hormonal disorders that we have to screen for. So sometimes you might find your doctor send you to do a thyroid profile with your thyroid hormones. We have to screen for adrenal tumors. We have to look for hyperprolactinemia. That's something I'm seeing a lot also in consultation, mainly expressed by irregular menstrual cycles and production of breast milk, not related to pregnancy or to basically having a recent one. So that's something else that we need to look out for, hyperprolactinemia. And we also screen you to look at your cortisol levels in case you present Cushing syndrome. So these have to be discarded for us to decide and say concretely that you suffer from polycystic ovary syndrome. These are some of the long-term health risks as I end the presentation of polycystic ovary syndrome. We hear about it a lot. It's repetitive. We have elevated lipids, fatty liver. That's another another issue that the Institute of Gastroenterology worldwide, they're trying to push the knowledge on fatty liver, that is fat around the liver. And it's very serious because what we're seeing is that as it progresses, I'm sure some of you all have heard of cirrhosis of the liver, which is very common in alcoholics, and a fatty liver can actually complicate into cirrhosis of the liver. So just imagine you already have cirrhosis of the liver. So just imagine you already have risk for hypertension, you already have risk for diabetes, and you're adding to that a fatty liver. Okay, so these are some of the complications: your basic cardiovascular disease, decreased bone mass density, infertility, mood disorders, sleep apnea, and those that scare us a little bit more, breast cancer and endometrial cancer. All right, so thank you very much. This was a short presentation. I hope you all learned and have a little more understanding of the hormonal imbalances that happen within our body as sisters. Please share information. Training and prevention is very important. If we can catch these things in time, we can actually, most of them can be reversed with lifestyle changes, can be reversed with if we have to do medical treatment, and we'll go ahead and do medical treatment. But the importance is that we build awareness and share the knowledge so we can reverse these disorders in time. Thank you very much.
Thank you, Dr. Esprit. What I wanted to do this evening is to kind of just take questions, if there are any, from the audience after each Maxime Esprit's presentation. Now is your chance. If you are shy and you want to wait till the end, we'll also give you a chance at the end. But in case there's any burning clarification or question that needs to be asked, you can go ahead. No, nothing coming from on the live? Okay. Okay, so Dr. Esprit, hold tight. We will maybe get a question for at the end. We are going to move on to our next presenter, and she is Dr. Deanne Robinson Amo. And Dr. Amo in 1996 left Dominica to pursue her studies, and in 1999 she graduated from the State University of New York at Stony Brook with a Bachelor of Science in Biochemistry. She then went on to study medicine at Howard University College of Medicine, graduating in 2003. Dr. Robinson Amo then continued her studies in obstetrics and gynecology at Cooper University Hospital, completing her residency in 2018, and she has continued in private practice here. In 2020, she was elected by her peers to be the president of the Dominica Medical Association, a title which she currently holds. And I want to personally commend Dr. Robinson Amo for being a gynecologist who always is willing to do these public education forums. It is a struggle sometimes to get gynecologists to speak on these women's issues, and I really am happy that you have joined us here this evening. So Dr. Amo, I welcome you to the podium.
Good evening, everybody. And it's my pleasure to be here this evening to share with you guys about polycystic ovarian syndrome. And as Ms. Christian was saying, I do have a passion about educating the public about health and health issues related to women's health and helping us take the best care that we can of ourselves. Today I've been tasked with I've been given the task of discussing the management of menstrual irregularities and subfertility issues that occur with women with polycystic ovarian syndrome. So what have we established so far? So we heard Dr. Esprit talk about what is PCOS and how we get to the diagnosis and everything like that. And so the question is, well, do I have PCOS? Well, one of the major, like Dr. Esprit said, one of the major things about PCOS, most PCOS patients have menstrual irregularities. That's one of the three things that in the criteria that we need to fulfill. With polycystic ovarian syndrome, the menstrual irregularities that we can get are amenorrhea, where we don't have a period for more than 3 months, or oligomenorrhea, where we have less than 9 periods a year. However, some of us do spontaneously ovulate, so we will have spontaneous cycles also. So why do women with PCOS bleed if they're not ovulating or they do ovulate? Like, what's going on in the body? Okay. They're bleeding, so there are 2 reasons why we bleed with PCOS. One, it's a normal cycle. You actually ovulated that cycle, and it's a very normal cycle. So what happens in the cycle? So let's start the cycle with menstruation. We're having our period, that is over with. The brain tells the uterus, the ovary rather, we need to ovulate. We need to produce an egg. So the ovary goes through the process of recruiting an egg. The egg develops in a cyst, and during ovulation, that egg is released from the cyst. That's estrogen smacking the ovary. And the egg is released from the cyst and it goes into the fallopian tubes and so on. At the same time, the uterus is preparing for that egg. And what is happening within the uterus is that the lining of the uterus is growing. Now, when the ovulation happens, that lining becomes even more thicker and more vascular because it's ready to accept an embryo. That's the whole point of the menstrual cycle, is to get us pregnant, believe it or not. So your body is getting ready for a pregnancy. When it realizes that, hey, it didn't happen this month. Okay, what do we do now? I clean the uterus out to start again. I menstruate. I bleed, I clean out the lining of the uterus. That's how a normal period happens. And that also happens in PCOS patients. Next slide. What else could happen is that we can bleed for other reasons. The other reason that we bleed is that lining grows so thick. Now, remember from what Dr. Espy said was that the hormones are not balanced. So you have, the brain keeps telling the ovary to tell the uterus, hey, we didn't get pregnant this month, you need to have a period, but the hormones aren't balanced. So the ovary is not hearing what the brain is saying. And so that lining just keeps building and building and building. And what this diagram is showing is that eventually it's going to outgrow its blood supply. So those little spiral arteries at the end of the endometrium, that's the blood supply that gets the uterus nice and vascular and ready to accept a pregnancy. No pregnancy comes, no signal comes to bleed, so I just keep growing. And what happens is that, next slide. What happens is that I always think about it as a lawn that is not mowed properly. So you can think of the lining of the uterus as you have your lawn, you have your garden, and today you decide to mow half the lawn. And tomorrow you go and you grow the other half. What happens is that the one that you mowed yesterday starts to grow. And so imbalance in the lining of the uterus. So when you do start to bleed, that bleeding never stops. So that's why you bleed for 2 weeks, for 3 weeks, for 3 months. And then you finally show up in my office. Thank you so much. If you're bleeding for more than 2 weeks, it's time to see your doctor. If you're bleeding for more than 10 days, it's time to see your doctor. Okay? Okay. So why is it important for us to menstruate? And menstruate regularly? Again, like Dr. Espy said, one of the things that women with polycystic ovarian syndrome is at risk for is cancer of the uterus, cancer of the womb, cancer of the endometrium. All these are the same thing. Endometrial cancer, uterine cancer. The risk increases with obesity and also with type 2 diabetes, all of which people with PCOS are at risk for. So it becomes extremely important for us to menstruate, for us to clean out that lining of the uterus. Usually, I would advise women that if you don't have a period within 3 months, take a pregnancy test. If it's negative, then I usually will give them a standing prescription to allow them to have a period. And we'll go into that in a little while. Next slide. So one of the questions that we ask a patient to decide what's the best way to manage them is to ask, well, are you trying to have a baby right now? If you are, then we go down one path. If you're not, then we do another path. You can go ahead and change it. So we're not ready to have a baby. No, not yet. What are some of the things that we can do? There are quite a few studies that show that reducing your weight by 5 to 10%, 30 to 50% of women with polycystic ovarian syndrome will spontaneously ovulate regularly. So how do we achieve this? Everybody will tell you, diet, exercise, calorie deficit. It sounds so simple, right? No, it's not. It is difficult for women with polycystic ovarian syndrome to lose weight. I've seen them struggle through it. I've seen it be a big weight, no pun intended, for them to carry. Some of the things that I have spoken to my patients about to help them to lose weight, and I will share that with you now, and because that I had within a week, I moved states, I started a new job. I didn't have time to diet and exercise. That just wasn't on my calendar of things to do that day. So, and counting calories was not something I was good at. But one of the things that I did, decrease my portion sizes. Easier said than done, yes. So one of the things I did, I used a smaller plate. So instead of using the dinner plate, I used a breakfast plate. Instead of using a regular size fork, I used a smaller fork. And what did that do? It tricks your brain into thinking that you're eating more because visually your plate still looks full and you have to take more bites with your fork. So that's one of the things that I did that worked for me. I'm not saying it's going to work for everybody. That's one of the things that worked for me. Other thing that worked for me, and also choosing your foods carefully. You want to have more of a plant-based diet, and you do also want to lean more heavily on the proteins and less on the carbs and the fats. Exercise. Finding the time to do that, for me, was very difficult. I gave myself 40 minutes a day, and when I first started, I could barely walk half a mile in that 40 minutes. By the end of my year of dedication, and it was true dedication to getting this weight off of me, I was able to run 4 miles in that 40 minutes. It is possible. It does take a lot. Next slide. Other things that we can do to help allow for regular bleeding of the uterus and to take away from the risks that we spoke about before is combined oral contraceptive pills. There are other benefits to that. To that androgen pattern that doctor was mentioning before. It helps visibly reduce the signs of hirsutism. It also reduces acne. There are contraindications to using this medication, though, that we have to balance very closely with the polycystic ovarian patient because obesity, hypertension, diabetes, all of which increase our risk for cardiovascular disease. Adding a combined hormone on top of that increases that risk even further. So patients who are candidates for this therapy need to be very carefully selected. Next. One of the more common therapies that we use are progestins and progesterones. We can use the progestins either cyclically or continuously. These offer uterine protection, but because they allow for shedding of the uterine lining, but they do not give you contraception. The progesterone-only pill does. Okay, that's a pill you take just like the regular birth control pill. And it will allow for you to have your period every month, but it will also give you that uterine protection that you're looking for and also contraception. An IUD with progesterone, I believe we have 2 of them on the market. There's Skylar, which is a 3-year IUD, and the Mirena IUD, which is a 5-year IUD. An IUD is an intrauterine device that is placed inside the uterus, and it will sit there for 3 to 5 years. It is placed by your doctor and removed by your doctor in the office setting. The progesterone IUD has an advantage over the others that are on the market because the progesterone acts locally within the uterus to keep the lining thin. Thin lining, less to shed, okay, less chance that we're going to end up with endometrial cancer. Metformin has been used in the past very liberally for patients with polycystic ovarian syndrome. Less so now, especially for patients without proven insulin resistance. However, it still can be used along with other hormonal methods that we spoke about to help us also regulate the cycle. So are you ready to have a baby yet? Not yet? Okay. So this is what the uterus looks like, and that is what a ovary is larger. It has these small cysts on it, and like we spoke about before, these are immature follicles that never matured enough to release an egg like we would need to ovulate. So they just kind of hang out in the uterus, in the ovary. Next slide. So like we said earlier, reducing your weight by 5 to 10%, 30 to 50% of patients with polycystic ovarian syndrome will naturally ovulate. And that is actually the better situation. So usually weight management, lifestyle changes are what we encourage first, if the patient has time. So if she's a 23-year-old and she has a couple years, then this is the line that we go down. If she's 37 years and we're counting months, we might want to skip that part, okay? However, there are risks involved in getting pregnant and being obese that we still need to talk about because it's not benign. When we're pregnant and we're with the risk of obesity, we have cardiovascular disease that we have to contend with. There are complications with the pregnancy, which include spontaneous miscarriages, which include diabetes and hypertension, baby that is delivered prematurely. And when it does come down to delivery, you're at a higher risk for C-section and in a higher risk of complications from that C-section. So pregnancy and obesity, there are a lot of complications that go along with it. So weight reduction with or without PCOS is a good idea if you're planning on getting pregnant. Next. So some of the agents that we use to help us have a baby. So, Doc, I haven't had a period in 3 months, in 6 months. How am I going to do this? Well, first we help you have that bleed, okay? And after you have that bleed, we start with ovulation induction agents like Clomid, Letrozole, and FSH injections. Okay. These medications are given at specific times during the menstrual cycle, and that allows for us to know to predict ovulation and allow you to have timed intercourse, or in some cases we can do what we call IUI, or intrauterine insemination, to also allow for fertilization of an egg. We check ovulation to see whether or not, that's okay. We check whether or not you're ovulating by laboratory testing. That's okay. We can do home ovulation kits. You can do like an LH kit where you kind of pee on a stick. It looks like a pregnancy test, and you get 2 lines if your LH is high enough, or and such. Or you can do a temperature kit where you test your temperature before you do anything in the morning. That one is a little bit more difficult because you literally have to be quiet on your bed as soon as you open your eyes to check your temperature. Any type of movement, or if you get off the bed and run to the bathroom before, is not going to be accurate, and you're going to miss that couple of points of degrees that you're going to need to let yourself know that you're ovulating. We can also have lab work done, usually done on day 21 of the cycle, to see what the LH is looking like, to see whether or not you have a good, strong luteal phase. And we can also check an ultrasound and see a nice, mature follicle to document that you've ovulated. One other thing that we can do to help you have a baby is ovarian drilling. Now, we don't hear about that too much nowadays. It was more popular earlier on, back in the day, I should say. But it works, okay? Basically what it is we go in, we do it laparoscopically now. In the past, they used to do it with open surgery, and what we found was that doing it open, you get a lot more scar tissue, or something we call adhesions around the ovary, which also kind of inhibits the ability to get pregnant. So that is one of the things that made this less attractive. However, with the development of minimally invasive surgery like laparoscopy, we basically put a small incision in the belly button, 2 smaller incisions on either side of the pelvis, and put tiny little holes in the ovary, okay? Anywhere from 6 to 9 holes in each ovary. Usually what happens, well, it's just a needle, a heated needle that you kind of push through the ovary, so you're creating these little cavities, basically reducing the androgen secreting portion of the ovary. And between, the success rate is actually 80%, okay? Say what you will, that's a pretty good success rate. 80% of women will actually will start ovulating, will continue ovulating for years on end. So you actually give them a good window to allow them to have not just one, but multiple pregnancies. Where are the other interventions that we spoke about, the medical interventions, is per cycle or per baby rather. Okay, so their use is limited to one pregnancy at a time. You can switch the slides. With the difference between ovarian drilling and, say, for example, FSH injection, it's kind of laid out here, the advantages of ovarian drilling: a one-time minimally invasive procedure, normalizes endocrine function, restores ovulatory cycles, pregnancy and high birth rates are comparable to women doing FSH. The risk for having multiple pregnancies are not there like they are with full. The birth rates is comparable to ovarian drilling, and it is more widely available than the surgical option. The disadvantages that we have, again, for surgery is that it is surgery involved in having surgery more than just putting holes in the ovaries. A risk of infection, damage to surrounding tissue, bleeding, and the additional risk of post-operative adhesions, which is the scar tissue that I was talking about. Okay, forming around the ovaries and around the fallopian tubes, which kind of renders them inactive. It's something that we don't want to do. But again, moving from open surgery to laparoscopy, we found that we don't form as much adhesions. So the popularity of this surgery has actually been on the rise lately. And that's my short presentation. Any questions? Go ahead.
I have to write them. My question is, how do you differentiate between ovulation period and those which are, if you are certain you do have PCOS?
Well, one of the things with PCOS, so with the diagnosis, you have irregular menstrual cycles, okay? So that's one of the things that you can have. When you're ovulating regularly, usually cycles are regular. So usually you'll bleed every 24, 26, 28, 30, 32 days, whatever your regular cycle interval is. With people with polycystic ovarian syndrome, that cycle is a lot longer. And again, some of them will have spontaneous ovulation where the period is usually a normal length period. And in the times where they have bleeding because they have not bled for so long and now the uterus needs to shed and empty itself, those are usually a lot more prolonged bleeds. But for you personally, it'll be very difficult for a person to say, okay, this is an ovulatory bleed, this is not, if the bleeding might be for 7 days each time. Okay. Very good question. Go ahead.
I have a question. With PCOS, my first cycle was at 15. It stopped at 17, and now I'm in my 40s. My cycle is more regular than it has ever been in my life. What? I don't understand what's going on. Hold on. When it should have been regular, it wasn't regular, and now when it's supposed to be on its way out. It's becoming more regular.
Some people do say that. One of the things that, and I'm going to use something that you said earlier, and I can't say that this is your particular thing, but it could be that you were insulin resistant and now your diabetes is under better control, you have better cycles. Go ahead. Come on. Go ahead. That's a good one.
I was asking, when I'm not to recommend somebody wants to have a hysterectomy because of the disadvantage of having PCOS. It can be done, or you have to wait.
Okay, that's a good question. That's a difficult one. Hysterectomy is major surgery. Okay, and there's risk of surgery that we spoke about, infection, bleeding, damage to surrounding tissue. That's a big surgery. Understood, but we can mitigate your risk for cancer. So let's talk about what are the steps of doing a hysterectomy so you understand the risks that you're taking before you make that decision. One of the steps of doing a hysterectomy is pulling the bladder away from the front part of the uterus. Doing that, there's a risk to injuring the bladder. You can end up with a hole in your bladder and a tube which you pee out of for the rest of your life. Possible. Would have been worth it then. You can use the same thing and say, chop both my breasts off. No cancer.
But if PCOS, you have like ruptured cysts, and that's very painful.
That happens with all of us, honey. And taking your uterus out will not solve that problem. You need to take your ovaries out to solve that problem. Taking your ovaries out at a young age increases your risk for cardiovascular disease, increases your risk for heart attack, stroke, blood clots, increases your risk for diabetes and high blood pressure. Your ovaries are actually more important than just for ovulation. It's actually also important for bone health. Okay, so we need our ovaries for not just having babies.
So I think that's a mistake we make, that we think
It's just for the baby.
Yes. And that's why that was a difficult question, because there are a lot of, I understand what you're saying, but there are a lot of inherent risks involved in what you're asking for. And the risks of PCOS can truly be mitigated with good health care, staying on top of your health and seeing your doctor regularly, getting yourself checked up, being honest and open with your doctor, telling what's going on. Unfortunately, a lot of patients actually have to pull information out of. Okay, really, when was your last cycle? Was it a normal cycle? When did you bleed before that? You know, it becomes almost a tug of war trying to get information out of them so that we can properly diagnose and, treat. Also, some people don't want to hear that they might be at risk for diabetes, so that there's some things that we have to do.
And if I could add from my seat.
Go ahead.
That's why I explained that the base of PCOS doesn't really start at the ovary. That's another misconception that you all think. Because I have cysts on my ovaries, I have insulin resistance, but it's actually the opposite. Because I have these hormonal imbalances which begin here at the brain, at the pituitary gland, that's what causes me to have insulin resistance, cysts on my ovaries, etc. So for example, you will see cases where women actually they do remove their ovaries and so forth, and then they still persist with insulin resistance and other factors, especially when the adrenal gland is involved and you have production of androgens and male hormones at the level of the adrenal gland. So you can still have endocytism and all of that. Not necessarily when you remove your ovaries, that doesn't mean that you're resolving the underlying hormonal issues that are there.
Thank you.
I wanted to take a question from the live, and I know some people will have difficulty hearing, so I hope that if we ask the questions on the mic, then we would maybe have a better outcome. Somebody asked, if your period is regular and you are still not ovulating, what do you do? Regular period, and I guess not ovulating because not getting pregnant?
Well, the question is, we have to figure out, like you said, what's the reason for you not ovulating? What's the reason for you not getting pregnant? You might not be getting pregnant because you have a blockage in your tube. You might have fibroids. You might have structural abnormalities of the uterus preventing you from getting pregnant. You may not be ovulating but still having a regular period if you have something we call a luteal phase defect, in that your hormones, again, in the latter half of the cycle, after you should have ovulated, are not balanced properly. Okay, and so either that phase is longer or shorter than it's supposed to be, throwing everything off.
Okay, we're still having some audio difficulties, but we will move to the next presenter. Thank you so much, Dr. Amo, and let's see if we can remedy the audio. I mean, those of us who are here are hearing, but our online viewers are struggling a bit, so let's see. I invite you to the UE Open Campus. You can still come. So I know some people really want the information, make your way across to the UE Open Campus. We're here, we'll welcome you. with open arms. Let's move to the next presenter for this evening. She is Dr. Alicia Honoré Felix. Dr. Felix attended the Wesley High School and then went on to study biology at the Dominica State College. She studied functional medicine at the Institute for Functional Medicine and also studied alternative medicine and holistic nutrition, natural health at the Pure Naturopathy School. She's a certified Food for Life instructor at the Physicians Committee for Responsible Medicine, and she's a holistic health coach. Her private practice is called Beyond Optimal Wellness, and she specializes in lifestyle and functional medicine for diabetes type 2, obesity, holistic cancer care, which includes digestive, autoimmune, and hormonal and mental health concerns, PCOS, reflexology, vagus nerve therapy, and corporate wellness. I welcome to the podium this evening Dr. Alicia Honoré Felix to present to us.
Good evening, everyone. Are you cold as I am? Yes. Okay, but it's still good to be here, and I'm so happy to be part of this discussion with you tonight. And to the online viewers who are not hearing, my voice is even more soft, so I'm going to try to speak louder than I normally do. So the opportunity is given to me tonight to speak on diet and lifestyle changes that help manage insulin-resistant PCOS. Now, how many of you know the different types of PCOS? Or do you believe that it's just PCOS alone? Yes? No? All right, so there are different types of PCOS, right? So there's the insulin-resistant type, there's the adrenal type, there is the inflammatory type, and there is the post-pill PCOS. Next slide, please. So if you're diagnosed with the insulin-resistant type PCOS, I'm here to bring good news to you that there is a lot that you can do to not only treat and manage, but you can also reverse that type of PCOS. Now, before we get there, let's do a little recap so we're all on the same page. Is that okay with you? Yes. Perfect. Let's take 10 seconds, though. Next slide, please, for a moment of silence. If you want to close your eyes, you may do so. But just to know that you are enough, just to know that you are present, give God thanks and praise that you are here despite of all what you are going through with PCOS. You are making it. So give yourself a round of applause in your mind or wherever. And we are warriors, right? PCOS warriors. Next slide, please. So insulin-resistant PCOS type. I'm not sure, I came in a little late, I'm not sure what we discussed in terms of the factors that contribute to insulin resistance. But from this cute picture that I have here, we know that there are lifestyle factors, there is the genetic factor, and there is the environmental. There are the environmental factors that contribute to insulin resistance, right? And when we have insulin resistance, one of the things that can happen is that we will have high insulin levels in the blood. And as a result of high insulin levels in the blood, different things can happen in our bodies. One of those things is weight gain, which we don't like at all in our tummy areas. We prefer it in our butts and other areas, right? But most times it's in our abdominal areas. Another thing is that we have lots of cravings. It's like more we try and eat healthy, or more we eat, we still have cravings, and most times it's for the unhealthy things, right? And then another thing that can happen, we will have hyperandrogenism, and this can result in having acne, hirsutism, as doctors mentioned before, hair loss or thinning of hair, the oily skin, anovulation, and amenorrhea, as Dr. Amo mentioned before. Next slide, please. So the insulin-resistant PCOS type, it is actually the most common type of PCOS. And it doesn't matter whether you're overweight or you're on the thinner side, you can still have that type of PCOS. And on the number conditions, I think most of us know what happens with insulin. But for those of us who don't know what happens with insulin, when we eat something, right, our body converts it to glucose and then release of insulin from the pancreas, right, to allow glucose to enter the cells. But when we have, next slide please, when we have insulin resistant, or our cells become resistant to insulin, our blood sugar levels they will be elevated, and our body might not produce or be able to get enough insulin to help glucose get into the cells. So our body keeps producing more and more insulin in order to compensate for that. Now, because of that sluggish or slow response, that can cause glucose to accumulate where? In the blood, right? And eventually that will change the way our body deals with sugar. Hence the reason we have what we call insulin resistance. Next slide, please. So other facts. Insulin resistance or high insulin, it can be both a symptom, it is also a physiological driver, and it's also a type of PCOS. So it's definitely something that we have to deal with. High insulin can impair ovulation and cause the ovaries to make excess testosterone. Now, do we know what are some of the signs of excess testosterone? Yes? So we as ladies, for example, we're not supposed to be having all of those beards there, right? And maybe some of us, we have a lot of shaving sticks in our room because when we see one little here, we want to shave it off quickly, right? That is not supposed to happen in a normal female. So that is one of the signs to know that we have excess testosterone. What are some of the symptoms of insulin resistant PCOS? So earlier with the skin, right? Sometimes we have it at the back of our neck levels, sometimes it's in our armpits, sometimes it's between our legs, in our thigh areas, and behind it is where I have seen it most commonly. So sometimes I know we tend to say in our local dialect, is quas the person have at the back of the neck. It's not necessarily quas. It is just that they are insulin resistant and most people don't even know it. And maybe I know some mothers try and scrub it out so hard saying it's quas, but it doesn't come out. And unless we don't correct that defect, it will always be there. Another symptom is fatigue, increased hunger and thirst, frequent or increased urination, as well as tingling sensation in the hands or feet, which is also a sign of poor circulation. Next slide, thank you. So, how do we restore insulin sensitivity and no longer have insulin resistance? Do you think we can do something about it? Of course, we sure can. Nothing is impossible, and where there is a will, there is a way. So, as Dr. rightly mentioned, taking a birth control pill, it doesn't reverse insulin resistance. It's like basically helping the situation, but it's not going to reverse it. Now, as a functional medicine practitioner, I am all about reversing and trying to restore things back to health. Wouldn't you like that, to know that your condition could be reversed instead of having to be on birth controls or medications for the rest of your life? Yes? Well, I would definitely love that. Next slide, please. So let's talk a little bit about the lifestyle changes that we can do. Now, I know most patients with PCOS and people who suffer with NCDs in general, when we talk about lifestyle changes, we say, oh my gosh, here we come about with the diet and the sleep and all of the things that we are so guilty of doing and we're not ready to give up of. But if we want to get better, then we have to make sacrifices, right? And those sacrifices will help us not only to be more insulin sensitive, but it will help us to be better and healthier. So, balanced nutrition, physical activity, getting sufficient hydration, sunlight and vitamin D, getting ample rest, reducing alcohol intake, stop smoking, stop sugar consumption, learn to manage stress and self-care. Quite a long list, right? But with every one of these listed, there is a benefit. Next slide, please. So I like to put this here. If you're a Seventh-day Adventist, or you may have known this acronym that says NEWSTAT: Nutrition, Exercise, Water, Sunlight, Temperance, Air, Rest, and Trust. And you can apply it in every aspect of your life, not only with PCOS. Next slide. So most women with PCOS ask me all the time, what is the diet for PCOS, doctor? There is no specific one diet for PCOS. All of us are uniquely different and beautiful, and what may work for me may not work for you. So there's no one diet that fits all. However, studies have shown that there are different types of foods and different types of habits that can manage the condition and that can help you get healthier. Let's look at some of these. So a low glycemic index diet. And for those of you that don't know what is a low glycemic index, basically the foods that have a low glycemic index means that our body digests the food slowly, hence the reason glucose is not elevated as quickly compared to with other foods. So consuming foods of a low GI diet like whole grains, legumes, nuts, seeds, starchy vegetables and fruits have a low glycemic index, and these are one of the things that can help with insulin resistant type PCOS. Eliminating simple sugars from our diet, that also helps to stabilize our insulin levels, and it also helps to restore our hormonal function. And lastly, an anti-inflammatory diet. All disease starts with inflammation. And when I say inflammation, I don't mean acute inflammation, I mean chronic inflammation. If you can remove inflammation from your body, not only will you be removing PCOS and its symptoms, but any disease that you are at risk for, you will be removing it out of your body just by decreasing inflammation. So having an inflammatory diet or eating anti-inflammatory foods definitely helps. And what are some of these? More veggies, more fruits, especially the leafy green ones, berries, and so on. All of these help. Next slide, please. So you can go ahead. So what are some ways to create a PCOS-friendly diet? Now, I personally diet. When I hear diet, I start thinking of all of the things that are nice that I don't want to have. So I prefer to term it as a lifestyle. When you think of it as a lifestyle, in one way, it's like tricking your brain to not think of it's going to be 1 week that I'm going to do this. If it's going to be a lifestyle, your brain is expecting you to continue it. Even when you fall down, you can get back up. Now that dessert, it looks pretty nice, right? The picture, it's a chocolate mousse, but it doesn't have any sugar, but it's still very sweet, and it has all of the nice nuts and grains. So we can definitely healthy, and it still tastes very good on a PCOS diet. Next slide. So ditch the diet mindset. As I mentioned earlier, if we believe it to be as a lifestyle, our brains are more susceptible to having that sort of diet in terms of reversing PCOS. And counting calories, as Dr. mentioned earlier, it's pretty hard. Imagine you have your family and your busy schedule, and each for every meal you have to be counting. If it's 1,000 calories or 3,000 calories per meal, it is a job all by itself. So I say let's make it simple. Have healthier foods as much as possible. More grains, more veggies, more fruits, more provisions. Keep your portions small, and you will definitely be okay, and don't need to be checking your calories as you would have to. Eat intuitively. Now we know a busy working schedule, especially us as women, and we are always on the run. We don't have the time to sit down and enjoy our meals. When we're having our meals, either we're on the phone or we're always doing something. We just want to push something down our throat. Am I speaking truth? But we need to take time to enjoy our food, so our brain know what we are eating. And of course, we need to take time to prepare our meals. Sometimes we make time to take care of everybody else and prepare the meals, but when it comes to ourselves, we are not doing that. So if we are giving our body food that is not medicine, how is our body going to respond? We are going to get sick. We're always going to be inflamed, and the PCOS symptoms will continue being in our body. That's okay, go ahead. So a balanced plate, legumes, grains, veggies, and fruits. Now on this pretty plate, you will not see that there is any meat here or any animal products. Instead, you will see there is legumes. And why? Because in order to reverse and manage PCOS, as well as any NCD, and in order to get healthy, a plant-based diet is what is recommended. 100% of studies have proven this and shown this, and we know that The intake of animal products comes with the added saturated fats and added cholesterol and the extra hormones. Remember, in PCOS, we already have a hormonal imbalance. So when you're taking in extra hormones or false hormones, it's even worse for you, right? Hence the reason for. So eat PCOS friendly foods, as we said, clean and lean protein, antioxidant rich foods. So eat from the rainbow. We in Dominica, we have a variety of local fruits and vegetables. Yes, they may be expensive on the market, but if we have our own little backyard garden and we can get a variety of foods, then we can make it work, right? So eating from the rainbow, so we can have all of the foods that help to fight inflammation and fight PCOS. Healthy fats, the right carbs, estrogen binders, and cultured foods. Next slide. Eat PCOS friendly snacks. So we mentioned about the cravings earlier on, and all of us want to munch on something sometime. Most time it's something sweet and salty. So if we can make healthier snacks that are PCOS friendly, let's say like a green apple or a smoothie or chia pudding or coconut water, which we have a lot right now. All of these help to balance our sugar, our glucose levels, sorry. Next slide, please. Consider a clean protein powder. Now this you will not be needing if you're getting enough protein and legumes from your diet. But if you know you're not getting that, then you can always have a clean protein powder, preferably a vegetarian one. Next slide. So some eat foods that are naturally sweet. Since we're always craving for sweet things, if we can have apples and other fruits and foods that are sweet, these will help to curb our sugar cravings. Have foods that boost energy, because most times we are fatigued and tired. And it's like more we sleep in the evening, we wake up in the morning and we're still feeling fatigued. Or even in the afternoon, most times after we eat and we don't take our digestive walks, we are so tired. However, if we're eating foods to boost our energy and we also following the other lifestyle principles, we are on our way to reversing PCOS. Not skipping meals. Not skipping meals. Most people skip breakfast, lunch, or dinner, or they don't have time to eat. That does not help the situation. Fasting that way, especially not when you're not under the advice and care of a medical professional, it's not very good. If you want to do intermittent fasting or you want to try a different type of diet, please ask your doctor what works best for you. Don't just go and try keto or paleo or all those pretty fancy diets that are out there without the advice of a nutritionist or a medical professional. Now practice self-care and self-compassion. Earlier on, we took a moment of silence just to appreciate ourselves. But self-care involves us being healthy. Take some time to go out. Take some time to cook for ourselves. Take some time to be pretty and do whatever it is that makes us happy. Next slide, please. Now, anyone in here has stress, or anyone on the live? Do we have stress? From the time we wake up in the morning, we have stress. Even when we're sleeping, we're stressed out. That's why some of us cannot, not us, but some people, I said very well, that's why I say not us. That's why some people cannot sleep, because they're on the heavy amounts of stress. So some people, the stress is in the work, sometimes it's at home, sometimes it's at school. We need to learn to manage stress. So if you're in a toxic relationship or in a toxic workplace, you have to find a way to do the job that you love while you're in there, but most importantly, manage the stress, because when we have stress, it signals, a message goes to the brain to signal cortisol. When cortisol is released from the adrenal glands, that is one of the ways that increases insulin, worsens insulin resistance, and that is what we don't want. So stress, we need to deal with it. Next slide, please. So we spoke about the principles of New Start. Nutrition, why do we need proper nutrition? For good health and for recovery. Exercise. If you are not accustomed of exercise, you have a job that lets you sit almost the entire day. Even if it's 5 minutes, you can keep moving. start with 5 minutes. But don't just stay sitting and say, why do I have no time to exercise, etc. Make the time. So start with 5 minutes, improve with 10, 20 until you get where you want to get to. But don't just stay at 10 minutes and say you're exercising, okay? Water. It is very important to be hydrated, especially if in your job you're always under the air condition or you don't like water. If it means you have to, thanks for drinking your water, darling. If it means you have to flavor the water for you to drink it, of course not with sugar, but with fruits or lemon, but you have to drink your water. Remember, 70% of our bodies is made up of water. So when we're not drinking water, that means our bodies are dehydrated. And with dehydration comes poor circulation, etc., and inflammation continues to rise in the body. So it's important to drink water. Getting sunlight. Most of us are inside, and most of our levels, especially with PCOS, are pretty low. Now, doctors don't really ask to check for vitamin D levels. Right? When you go for your general checkup, it's most times it's you that have to ask for it. I advise you, ask to check your vitamin D levels, because it's one of the things that will help you with reversing PCOS and dealing with your health. More important than food or water, proper breathing. Now, if all of us had to take 20 minutes to breathe properly, I don't think the world would be continuing. But whenever we have time, if it means waking up in the early morning when we get our proper exercise, it is important to breathe properly and get clean oxygen so that our cells can bring proper nutrients and vitamins to the blood as needed. Next slide. I'm almost done. So some of the supplements for PCOS include magnesium, inositol, and vitamin D, which we spoke about. What is the importance of vitamin D? It increases insulin sensitivity, lowers inflammation, and definitely helps with hair loss. Now, inositol, it has the ability to act like insulin, and it also helps to restore ovulation and fertility, which I think everybody wants to get pregnant with PCOS, as hard as it is, right? And then with magnesium, most times in PCOS, our magnesium levels are pretty low. But when we start taking the supplement, or if we can get it from foods, it increases insulin sensitivity, and it also helps to lower our blood sugar levels. Next slide. Okay, we spoke about this. Next slide. So, optimal lab levels for PCOS insulin resistance. When you go to your doctor, ask to do a fasting insulin, and we're looking for levels to be less than 4. For the hemoglobin A1C, we're looking for levels to be between 4.8 to 5.2 optimally. Leptin, we're looking for levels to be between 17 to 20. And there is one more I'm not seeing. But anyways, the fasting glucose definitely optimally is between 80 to 85. That's the fasting glucose, okay? For the optimal lab values, that's when you know that you are in the process of being more to insulin sensitivity than insulin. And we reach that stage of excellence with PCOS, with the PCOS diet. This is the phase that we will be having. Your hair will be let out like this with the nice smile, even if it's short hair you have. That is how it's going to be. This is the smile you're going to have because you will have known that you have put in the effort and the work to get there. Next slide. So it's never too early or too late to work towards becoming the healthiest. Small healthy choices make a big difference in the long run. And I think we're on the last slide now. Apart from this one, the references. Thank you for your attention, and I do hope that you have not only learned, but will leave with hope and motivation to fight PCOS, especially with insulin resistance. I thank you. If you have any questions, I'm available.
So we had a question coming in through the live, doctor. Is dairy good for PCOS? That came up when you were talking about the anti-inflammatory diet.
So, no, dairy is not good for PCOS. Dairy comes from animals, and I definitely do not promote any use of animal products, be it yogurt, cheese, milk, eggs, meat, anything like that when it comes to managing PCOS or managing diseases in general. However, lately in Dominica, because of what we're promoting, healthy lifestyle, etc. You can get vegan cheese, you can get vegan mayo, you can get almond milk, coconut milk, all of those alternate dairy options, and it is very nice actually. And if you want to make them locally or homemade, feel free to shop me for some recipes. But definitely no dairy or animal products.
Any questions? Yes.
Because of fish, I know you say animal products, so I'm just trying to find out would fish be in that category as well?
For the listener, she asked if fish should be considered in the animal category as well.
Definitely. So fish is an animal, has blood. Most times, especially in our Caribbean culture, we tend to think as fish as a healthier option to chicken and red meat, etc. But fish also has, apart from the contamination in the seas, etc., just think about it. When you're cold, we use the fat on our bodies for warmth, right? So imagine the amount of fat that fish itself have always up there in the sea, apart from when we catch them. So apart from the contamination that they may have in the water, they do have a lot of saturated fat, and that is one of the things that happens with insulin resistance, preventing glucose from entering the cell. So yes, fish is also prohibited. However, we are transitioning, right? You cannot just throw out all that you have from your fridge right now, or not cook what you have. So I say go slowly. The days that you still having animal products, make sure you're having more veggies, more fruits, etc., until you get to the point that you no longer need them and you're at the healthy stage. So yes, thank you.
But I have tried to transition from animal-based to plant-based, and there are certain times when I crave meat for meat or fish that I just can't control that I have to go for a barbecue chicken and I have to start. No, I'm serious. And it's like I feel like I have failed and then I have to start all over again. So it's like I will go a week, 2 weeks, preparing for a week. So how do we combat that? Is there any little trick that we can use?
So that is so very true. It happens to the best of us, and it takes 3 weeks to create a habit, especially a healthy habit. Most times you start having those cravings, apart from if you're not lacking magnesium, zinc, or any of those nutrients, and you're still having those cravings. It's because your body is almost in that path to go to the next stage. When you give your body the barbecue chicken or whatever it is that you're craving for, yes, it's like starting back all over. So it takes a lot of self-motivation and self-will to be strong to just move past that. And call me if that ever happens. Maybe I'll make you some barbecue tofu or something like that, or pray for you or something, and we can make it past that stage. But yes, it happens to the best of us. And thank you for that question, for being honest.
Okay, Dr. Honorary Felix's information is on the screen. I know somebody in the live was asking for contact information, so her contact information is shared right here. I feel we have 2 more presenters this evening. We're going to go into the treatment, both the herbal aspect as well as the pharmaceutical aspect. We have 2 sides of the coin this evening. I feel from Dr. Honorary Felix's presentation, we should move nicely into our herbal aspect of treatment this evening. She spoke a lot about natural eating and plant-based diet. So let's move to the herbal aspect. We are joined this evening by Mr. Ronald Deja, who is a man of the soil, Dominica, and he has worked as a trained pharmacist, tasked with dispensing and formulating drug medications and serving the public at a local pharmacy for 3 years. However, he trained knowledgeable indigenous elders living off the earth, and he spent years learning about natural herbs and plants native to Dominica and other parts of the Caribbean and the world. Mr. Deja, or Parker as I know him, also worked under Master Herbalist Ferdinand Charles for a number of years and was a member of the Caribbean Herbal Business Association starting in 2006, and later a member of the Dominica Herbal Business Association, where he served a term as president of the organization. During his time with these organizations, he traveled and he completed a number of trainings in Jamaica, Trinidad, St. Lucia, and other parts of the Caribbean, and he has participated in seminars and workshops on herbal medicine, quality assurance, and in support of the herbal industry, Mr. Deja founded his own company, Roots Herbal Remedies, inspired the mission to promote the value of herbal medicine as a credible part of the primary healthcare system in our communities, as well as to promote a sustainable herbal medicine industry. He believes in promoting wellness and healing that stems from the natural resources available to us right here in Dominica, and as such, he has dedicated his life and service to this mission. He specializes in areas such as nutrition, herbal medicine, and physical therapy, such as massage and applications using healing oils, poultice applications, and other similar therapies. He's the owner and operator of a vegan restaurant, Roots Healing Foods, in Roseau. That's why I knew the segue will be nice to go into Mr. Deja after Dr. Honoré Felix. And he promotes nutrition as a key part of healing and the healthy sustenance of communities and families. Mr. Deja, good evening to you, and I welcome you to the podium.
Good evening to all, those who are present and those who are in the technological world. As Ms. Trudy said, I am a natural doctor, or you would say a herbal physician. And you would ask, what does that mean? Well, a herbal physician is one that sees health from the spectacles of Mother Nature, nature which we are all a part of. And because of this approach, I tend to simplify health and even simplify illnesses. So I am going to give you a with hormonal disorders and my results in treating such conditions. I want to ask you a very important question. Did you know that herbal medicine is one of the purest forms of medicine for healing? Are you aware of that? Are you aware of the very father of medicine, who we call Hippocrates? And at present, the very establishment from the conventional medicine consider him to be the father of medicine. Do you know that he have healed all diseases known to man through the medium of natural medicine? I'm here to tell you that we have the privilege to explore that medium. And that's where your humble brother comes in to educate you. In my research on PCOS, there is no one factor that can create the problem. It's a concoction of factors. And because I know, as my former speaker alluded to, diet, because I know we are what we eat, we always look at the foundation of the disorder or the disease. And with PCOS, we consider it to be what you call a metabolic disorder, a condition where you have excess of whatever, of a particular hormone that your body cannot synthesize or break down, thus causing an imbalance. Nutrition also helps with our mental awareness and mental alertness. I will go ahead to speak of one of the main glands, which we mentioned, the pituitary gland, but we have not discussed about the hypothalamus gland, which also works along the pituitary gland to release these hormones to help to regulate or cause what they call a homeostasis, within this entity that we all have. And women, you're wonderfully made. You're wonderfully made not just by the words that I speak, but it is written. You were wonderfully made by one with infinite knowledge. And he has designed you. And before he have accepted the finished product, he examined you and make sure that you had everything you needed for rejuvenating your health and living the best life. So I'm also here to tell you that, with no apologies, that your body has the ability to heal itself. You may say, my body has the ability to heal itself, but why can't I be healed from such a chronic disease? A condition that is so overwhelming. A condition that, up to this present day, we are seeing the rising of numbers with hormonal imbalances. So it leaves us to ponder, why are we not hearing any healing or cures from persons that are suffering from such conditions, mainly women? I will say to you that the approach that we have been educated about, the approach of any medical doctor can attest that the results that we perceive or the results that we want, it has not been forthcoming. And you may ask why. In my humble opinion, whenever we use synthetic drugs to treat a natural or an organic body, which we all can attest that we are natural or we are organic, or I should actually ask you that question, are we natural beings or are we synthetic beings? Excuse me? Are we natural beings or are we synthetic beings? Natural. Natural. So we all agree to that statement. Okay? So whenever we use chemicals or synthetic medication, we have what we call your physiology, the natural function of your body. With synthetic medication and this natural entity, there is no synergy, meaning that one will contradict the other. So in other words, treating any disorder or any imbalances with synthetic drugs, yes, you will suppress the symptom, but you will never address the root cause of the problem. And the evidence is overwhelming. I don't think any medical doctor can refute what I'm saying. But within the sphere of the conventional approach, we can attest that there's a lot of limitations. That's why I'm very thankful to Ms. Trudy that she has went outside of the box of thinking when it comes to medicine and see it fit to inculcate or incorporate the herbal practitioner into this equation. The reason why I am so confident in what I'm saying to you, because it is said that every single hormone, every single nutrient that your body contains, every single nutrient and hormone that can create that what you call homeostasis, that balance within your body, if there's any imbalance or deficiencies, the greatest medium is for your foods. And I am not speaking of foods and omitting herbal medicines, because I could tell you the most dense source of nutrients come from the plants, come from the herbs. Foods is not in isolation with your stress levels, with diabetes, with cancer, with PCOS, with infertility, with fibroids, with cysts, with endometriosis. All these conditions actually can stem from the foods that you eat. You may say, well, Mr. Deja, I mean, we have top medical doctors explain to us, but why are you coming with this equation about foods and nutrition? The reason why I'm saying this to you is because the very culprit of such condition, and we know by now estrogen is one of the culprits, we know that testosterone is one of the culprits, we know that progesterone, we know that all these hormones are considered to be growth hormones for regulating our bodily functions. Do you know that some of the foods that we eat contain synthetic estrogen? And the synthetic estrogen, we know them to be as xenoestrogen, where these compounds or these chemicals mimic estrogen in our body, causing our pituitary gland to release hormones, thinking that it's our natural estrogen. And this is one of the ways that we can cause that imbalance by eating foods that contain artificial estrogen. There are many foods I could list to you, but the last food that was mentioned was meat, chicken. Do you know that in times of old, a chicken used to take about 6 to 8 weeks for maturity before you can actually have it on your plate? But now in this present era, where we are experiencing through science genetic modifications, do you know that now a chicken will take at least 2 weeks to be mature on your plate, or to be in your box of KFCs? Why a chicken can get full maturity within a short space of time? It is because of the hormones that they inject these chickens with. It's because of the hormones that are in the very foods that this chicken use to get them to that stage. So whenever we, male or female, would consume such foods, don't you think that the very makeup of these foods is going to actually be part of who we are? Thus, this can create also a hormonal imbalance within women. We can also look at certain preservatives. We have what they call tetrabutylhydroquinone, TBH, TBHQ, tetrabutylhydroquinone. That's one of the preservatives. It's actually a byproduct of petroleum that you will find women. I know sometimes life can be very hectic, and the quicker the milk can be and to go, that's the norm of this day. You have a specific food they call ramens. Excuse me? Wow. It's like I felt I called someone's name. Yeah, ramens. We can attest that this is one of the cheapest foods in our supermarket. I think $1 and whatever change a pack of ramens. Ramen contains this TBHQ that is actually causing a lot of clogging of our system and causing these imbalances. We can also consider the canned foods. The lining in the canned foods contains synthetic estrogen. When you eat these products, definitely you're going to be affected. So I can say to you that the foundation or illness, besides environmental, besides emotional, your foods is the main area to consider in the reversing of any disease. Now, how can I identify these foods that can reverse conditions that are so-called be incurable to the present system that we all know? How can we identify the foods that we can utilize to heal this entity, this bone that we all carry? One of the ways to identify the natural foods, one of this way you can identify the natural foods is that they all should contain seeds. Because whenever you eat a fruit or vegetable, when you eat the fruit or the vegetable and you throw away the seed, that seed should be able to replicate the tree to bring forth more fruits for you. And that was how He who is infinite in his knowledge designed it to be. But in this present era, we find ourselves with GMOs. And how can I identify GMOs? Well, GMOs is actually the opposite of what nature has showed us. GMOs represent itself to you as seedless. So even consuming the seedless foods as women, it can also pose a detrimental state to our health and even our reproductive organs, our reproductive system. And to break it down, to simplify it even more, whenever you eat the seedless fruits or the seedless foods, because the seeds have gone through a process they call sterilization, you can actually cause yourself to be sterile. And whenever you're sterile, you know infertility kicks in. You cannot have any babies. So you see how it is very sensitive in choosing foods, because the outlook of genetically modified food looks similar to the natural foods. So be mindful of any fruit that you choose to eat, whether it be grapes, whether it be watermelons, whether it be oranges, whether it be limes. Always choose the seeded fruits. Because in truth and in fact, we are living in an era now that it is so difficult to choose what to eat. I know women can attest to that. It's like, what to eat? Okay, this herbalist said don't eat this nutritionist said don't eat that, but what should I eat? My wonderful people. My wonderful women. And I speak to you and I feel kingly. And why I feel kingly? Because you are queens. And I came from a queen. You might also say, but what is this man talking about? This man do have no female organs to experience what we're experiencing. But I'll tell you, a lot of women now, they're fed up of using contraceptives. And they resort to the natural healers. And the numbers are increasing because of the evidence that every single illness that we encounter is on the rising, not on the decline. So persons are looking outside of the norm and coming back to Mother Nature, not to Deja, to Mother Nature for a solution. Because she has the solution and you are part of her. So your body has the ability to transform itself. But it takes your determination, it takes your encouragement, it takes your discipline to formulate that solution. Women, I know the task is great, even might be greater than men. One of the areas that you may find yourself being overwhelmed with is what they call stress. And stress is another key factor towards the condition that you're experiencing and beyond the condition that you're experiencing. We know stress can lead to cancer, and we all fear of cancer because cancer can be fatal. I'm saying to you that the more stress that you give yourself, we know we have mentioned about the kidney and the adrenal glands. The adrenal glands will release hormones to help to bring that balance, that homeostasis. But think about it, continuously being stressful. The raw materials that the adrenal glands need, when it's worn out, it's going to look for somebody to compensate for that raw material to assist in keeping the body on a balance. Continuously, we know that it is our hormones. And this hormone is progesterone. So, continuously being stressed and using up your reserves, definitely that's going to create this hormonal imbalance that you have at present. We could also say it's psychological. Psychological meaning what? It's part of your central nervous system, your brain. And whenever we find ourselves eating foods that are not in sync, or what you call adulterated foods, or foods of inflammation, it also affects our brain, our mind. As I said earlier on, we are what we eat. So from this fear or this angle of attempting to reverse your condition, I could attest to you that this approach has not failed even me myself, which I'm considered to be one that is still in the learning process. Because if I say to you tonight that consecutively on 4 occasions we have found success in such conditions, consecutively, we locally know what they call flukes. You know, you try once, it happened, you try again, it didn't happen. But with natural healing, natural medicines, I have seen consistently the results that I bring to you this evening. And one of the results with infertility, I could say to you, it's very easy for a woman to get pregnant. But you say, Mr. Deja, I've been trying for over a decade now. Why am I not getting pregnant? Have you considered the foundation on which I laid? Considering nutrition and what you eat, what you put into your body? Holistic approach. Because a simple condition I would call constipation, irregular bowel movement, can also lead to an imbalance also. Are you aware of that? Well, I'm making you aware of it. Because the condition, as I said in the beginning, is a metabolic disorder. So whenever you're constipated, you have a lot of toxins and waste remaining in your body, can contaminate your bloodstreams. And at the end of the day, your system can feel very clogged. So one of the first approach to really helping to reverse this condition is to detox, what they call detoxification. And that is the area that I use fundamentally with all my patients. And I could guide you on what methods, simple methods you can use to start that process. Shedding weight is very simple. Losing weight is very simple. I'll repeat it again. And mind you, I'm speaking to you with no doubt. Normally, the zeal of this work I do take over, and I would be like, pointing to you, but I feel a female energy, you know, to keep me calm and collective, to give you this information, and to make you feel that you have the ability to reverse your condition. And I'm saying to you, you have the ability to reverse your condition. You can't do that through the means of contraceptives. And if you use contraceptives, which we know this is the main medium for suppressing symptoms, do you know that contraceptives will cause a greater imbalance? The side effects of the contraceptives actually tell you that you can suffer from PCOS, hormonal imbalances. And sad but true, that's a term to eliminate because I've been told sad but true is a long time thing. But sad but true, that is the best medication that would be prescribed for even a young adult if they have any menstrual problems, like excessive bleeding. And imagine a child from the age of 12 up to the age of 20 being on a contraceptive for that period of time. Don't you think that your body is going to react abnormally to this synthetic approach? Yes, it's going to be. It's going to react. Because the very books that are the privilege to revise says that after 3 to 5 years of any medication that you're on, you will, not might, you will experience side effects. And we need to be aware of that. We need to allude that. Because I know genuinely it's not about the pharmacist or the doctor. It's about we coming together and trying to find a solution, you know, to build a better Dominica, a better woman, a better society, to thrive and to live a better life, a healthier life. So I'm saying this to you, not to contradict the present approach, but rather to meditate and to give thought on what I am saying to you this evening. Because, I repeat again, I'm certain if we take the right approach to healing, healing is part and parcel of life. We can achieve healing, we can accomplish healing. We also consider a physical approach or a therapeutical approach when it comes to such conditions. We know that the cyst, it is made up of fluid. It's not fibrous, it's made up of fluid, water. One of the areas or one of the therapies that you can apply, especially on your uterus area, is what we call a warm compress. And a warm compress, if I have to break it down to you or simplify it, it's simply having a towel saturated with a specific herb. And you would apply this as warm or as hot as you can stand. Not to burn yourself, as hot as you can stand. With this therapy, you may do it for a period of 10 to 15 minutes. Thereafter, we highly recommend our local black castor oil. Our local black castor oil can be used as a castor oil pack, meaning that you're going to saturate whether a piece of cotton cloth in castor oil. You may simply saturate the cloth. You would use heat. Heat is part and parcel of healing. Heat will dehydrate this fluid in the ovaries. So you would actually heat up the pad, saturate with castor oil, and you simply apply it on your womb or uterus area. If you have what they call a heating pad or heating bottle, the hot bottle where you add hot water, you could just apply it on your tummy area, cover it nicely, and relax. With that, you could have a nice tea of dandelion, because we know dandelion, it's very good, or it's actually what they call an adaptogen. Dandelion also contains what they call inulin. We mentioned insulin can lead to diabetes. Dandelion also contains inulin. We can mention of another herb you can use while you have the hot compress on your uterus area. It's called red raspberry. Locally we call it fouez. These herbs have proven to be very effective for female disorders. And these herbs are also considered to be female tonics. It was actually made for you women by, once again, the infinite hand that have created and fashioned you. I mean, I could say many things because I have a display of herbs, which I may not have the privilege because of time to go through them step by step. We also have a local herb we call kojo root. Kojo root is excellent for shrinking and melting tumors, whether they are benign or whether they are malignant. Kojo root is also highly recommended for cancer, especially breast cancer. And these are all herbs that we have locally in Dominica. Yes, it's all over the Caribbean, it's all over the world. But we have the privilege right in Dominica to just go in our backyards and pick the herbs I've mentioned so far, thus far. We have conditions, as I going to address one of the thoughts or the opinion of one of the audience, the people in the audience. One mentioned that it's better to remove your womb rather than to be bleeding and have excruciating pain. But do you know that whenever you have a hysterectomy, you make yourself more vulnerable to breast cancer? Did you know? Do you know whenever you tie your tubes, you make yourself vulnerable to breast cancer? Because you need to understand that this wonderful organ, not just for bearing babies, your uterus, not just for bearing babies, but this wonderful organ actually makes a woman a woman. Your womb. Without your womb, what name can I call the woman? Your womb makes you a woman. And I am not saying this to make those who have already had a hysterectomy feel vulnerable. Yeah? I am saying this to bring more awareness to us. Because for too long, we have believed in this passive approach. For too long, we have believed in this one-size-fits-all approach. And it is not working. It is is not working, and it is said that doing the same thing over and over, we get the same results. Can anyone tell me what that means? Excuse me? I'm not hearing you. So are we saying that we have an insane system, medical system? You say that, I didn't say that, I asked you a question. So it is high time now we consider the essence of who we are. The essence of who we are is natural beings, especially being in this nature isle. We are blessed with a number of centenarians. I can attest to you that they have never even heard of what they call ovarian syndrome. They have never heard of such, because these things never exist in their time. And do you know why? Do you know why? I'm asking a question. Let's interact. Do you know why? The very essence of the land and the soil and using the natural foods, that is the essence that kept them, that gave them longevity. That is the fountain of youth that we have the privilege to explore. So I'm saying to you, I'm pointing to you, go back to Mother Nature. You are part and parcel of Mother Nature. For you have the ability to heal yourself. We speak of inflammation. Inflammation is one of the major culprits for a lot of the disorders or diseases that we're encountering. But what is inflammation? What can cause inflammation? And we need to consider this from the root cause. We have a number of foods that we eat every day that is highly acidic. Highly acidic foods will cause inflammation. Because what they will do, they will compromise your mucous membrane. They will erode your mucous membrane, leaving you more vulnerable to create inflammation. So how can we avoid inflammation? We can avoid inflammation by eating more alkaline foods. And the alkaline foods are the foods that pose the healing properties. One of these alkaline foods that I use, lemons. I highly recommend lemons to treat this disorder. And how would I recommend that you take the lemons? I would recommend first thing in the morning, from rising from your bed. You'd actually squeeze the juice of a lemon in a glass. And you're going to take the skin or the shell of the lemons and you're going to boil it in about half a glass of water. You boil it for about 5 to 10 minutes. And thereafter you add the very water back to the glass.
This live stream will be ending shortly. Please join us via our Facebook link,
along with that,
which is listed below in the
because
comment section.
This condition is a metabolic disorder, we highly recommend what we call carica papaya, scientifically known. Commonly, we know it as pawpaw. Pawpaw is an excellent food because it can eat away toxins in your body. How can I utilize it to be effective? The pawpaw. You leave the skin on the pawpaw and you're going to grate the pawpaw as fine as you can. If you would like, you have a food processor, puree it like you make baby food. And I'd advise you to garnish it. And mind you, natural food should not be unpleasant to your sight. Natural food should excite you, excite your taste buds. Because we know digestion starts. Where does it digestion start?
You could join us via our
Facebook link,
which is listed below in the comment section.
Excite yourself
Thank
with
you
natural
very much.
foods. So you would garnish your papaya salad nicely with your celery, your parsley, your gojai, your thyme. Would advise you use a pinch of sea salt. Also, a tablespoonful of coconut oil can be added. And I'm not recommending any quantity per se, but I'm telling you it to your desire, your content. This, you could incorporate this as part of your breakfast every morning to start the process. I would also highly recommend a drink rich in chlorophyll. Because we know that one of the agents to replenish, to rebuild our system is what we call phytonutrients. My former speaker spoke of antioxidants. Do you know that the purest source of antioxidant doesn't come from a supplement on a pharmacy shelf or on a drug shelf? Do you know? The greatest form of antioxidants and phytonutrients come from the plants. Because we need to acknowledge or be cognizant of we are living beings. And whenever we need nutrients to enhance this living entity, we need living foods and living plants. So the chlorophyll within the plants, it can help to restore your health. I would recommend as a combination that you can use 9 leaves of spinach, you can use 1 Christophane, you can use 3 stalks of celery, and 6 stalks of parsley. You could blend that combination in about 750 ml of water to 1 liter of water. You strain nicely, and you could have this as a drink, as what you call a cooling, locally speaking. You could have this drink at least 3 times for the day. Morning, afternoon, and evening. Before, after meals is your decision. And this approach, within a 9-day period, along with my detox package, within a 9-day period, you're going to see some weight start to shed. You're going to feel your tummy feeling lighter. You're going to feel less bloated. You're going to feel less congested. You're going to feel less angry. So that means something is creating some balance within this body. And the beautiful thing about herbal medicine is that it creates that balance. Many to say, but I will conclude by mentioning a very important herb, a very important plant. And if you see the smile on my face, maybe some of you might know what I'm talking about. A very important herb, and science now have proven and is attesting to us that this is a gift from God. A herb that was tarnished, that was demonized, that was considered to be a gateway to hell. Today, we're hearing that it is a gateway to heaven. And this beautiful herb is what we call cannabis sativa. Locally, we can call it cannabis or marijuana. Please, women, take me very serious. I'm not telling you and smoke and get high on any plant. Don't misinterpret what I'm saying to you. Even the very cannabis plant is part of the vegetable kingdom. Did you know? Did you know that you can consume the cannabis plant like lettuce or like spinach or like any other vegetable you may be using every day? Do you know that the cannabis plant contains what they call cannabinoids? Did you know that your body has a system called the endocannabinoid system that can recognize this compound called cannabinoids in the cannabis plant? Do you know that there's also a compound called THC, tetrahydrocannabinoid? And this THC, the receptors are predominantly in the brain. And this cannabis plant, it is reputable for being a herb that brings about homeostasis, balance. Because that is the greatest area for treating such conditions that creates imbalances. And herbs in general, that is the predominant use of the herbs, is to bring about that balance within the entity. I will conclude by reminding you that you were all created by a beautiful creator. And he has designed you wonderfully, that you have every single organ in your body to help you to live a long life, a happy life. But whenever we compromise these organs, then imbalances kicks in and disease may thrive. Whenever we eat foods that compromise our entity, especially animal products, which I can expound on, but I will keep it short. Animal products, my beautiful people, is one of the major culprits for disease. And I say to you that a plant-based diet has proven to be one of the most effective medium for keeping you healthy and keeping you strong. So let your foods be your medicine and herbs your strong drink. Thank you for listening here.